Thank you very much again to this panel. And Tom, our next panel is going to be on the topic of community revitalization and development and its relation to health. So if your question followed or related to your previous one, come back and ask it again if it doesn't get addressed here, please. As I just said, in a logical follow-up to this panel, we're now going to focus on a couple of communities where there are a whole variety of efforts underway to redevelop the economy and the civic life of communities. And to introduce that panel and moderate it, I would like to introduce Victor Rubin, whom you heard from earlier asking a question, Vice President for Research at PolicyLink. Victor.
Thank you very much, Ray, and all the members of the Planning Committee and the Roundtable. It's terrific that your group is paying attention to these issues and the connections between all the different levels of the issues that have been brought up today. The relationship between community revitalization and population health this is important reinforcement of a dialogue that's been very active for at least a decade or so, in which my organization, PolicyLink, has been privileged to play a part. There are at least several parallel movements underway, actually, and we should take note of them as we get ready to hear these two stories, the tale of these two cities. Obviously, there's a great deal of awareness and action among professionals in medicine and public health, and the members of this group are evidence of that. But there's also parallel efforts underway in all the different urban design and redevelopment fields: city and regional planning, landscape architecture, property development, architecture. I'm either a member or a correspondent with one or more national networks and statewide networks in California. Among all of those professions, being an urban planner myself and a fellow traveler in some of the others, and they're all focusing on the social determinants of health and what it means for their work. But there's also movement among community organizers and advocates from a whole variety of traditions. There are those that come out of environmental justice. There are those that come out of what's often called issue-based neighborhood organizing. And in each case, these community leaders, mostly low income, mostly people of color, have recognized that they can make those same connections between the social determinants of health and the overall well-being of their constituents, and find particular policies and practices on which to take action. And there's a growing body of work in which they have been doing health impact assessments, doing other kinds of analysis to back up that advocacy and organizing. There's also a tremendous connection between the issues you're concerned with and regional sustainable development and climate justice or climate change. And then last, of course, we're starting to see among various types of business enterprises a focus on the community determinants of health. Now, for the developers of real estate and developers of community, this is a very direct connection. You see a market for creating communities that allow for a more healthy lifestyle. But as we've also noted today, for health insurers and for hospitals, the opportunities to include clients and residents' health through a focus on the built environment are there for the taking, and we see an increasing number of them taking that up. And we've heard a lot about that this morning. So there's activity, practice, research, evaluation, policy advocacy underway in all these arenas. A growing body of evidence that the social determinants of health are just that. They're social. This is not a discussion of individual behavior as such, but more about how communities are constructed and how they operate and how residents are more or less healthy depending on the broader factors of equity and access to economic opportunity. So creating access to fresh food, retailing, or the chance to exercise is not merely a technical task or a design task that can be separated from the broader mission of creating a city that works for everyone and that provides everyone the opportunity to work and prosper. So again, it's important that we're making all those connections over the course of today. So we're in an era where a lot of American cities are being dubbed comeback stories, and we're seeing a large amount of new investment in their core areas, often places that had been abandoned. We're seeing resurgent populations, new forms of commerce, and widespread appreciation of the health benefits and the social benefits more generally of compact development, transit, less auto-dependent development. But it missed all this revival, and a few minutes ago we saw some reminders of this from George. We must remember that in order for the health benefits of this urban revitalization to be realized, that revitalization itself needs to be equitable and inclusive. So at PolicyLink, we refer to this as building healthy communities of opportunity, and we lift up examples wherever we find it. My colleagues and I have been working in San Francisco and Detroit for the past several years on different aspects of these issues of community building and economic revitalization. I'm really pleased we'll have the opportunity to hear from local experts and leaders about how that work is going, what it means for health equity generally, and what the role of business in particular can be. In many respects, San Francisco and Detroit are cities in very different circumstances, of course. The former, characterized by a current boom that has created not just tech-driven growth, but enormous pressures on the affordability of the city. I mean, even just in the conversations around the room, at least half a dozen discussions about how unaffordable San Francisco has become. Personal accounts in a number of in a number of cases, not even solicited. There's a rapid demographic change that threatens the historic diversity and character of the city underway. Detroit, by contrast, characterized by the emergence from the end of an era of manufacturing employment that led to massive disinvestment, population loss, property abandonment, and fiscal stress. Now, the differences between these cities are very real, of course, but don't let the headlines be your only understanding. There are counter stories and similarities that are also worth looking into. An isolated public housing development in San Francisco will present many of the same health, education, and safety challenges for children and youth as does that same type of development in Detroit. And in Detroit, you can find the hipster coffee shops and the startup business incubators for the creative class and the tech entrepreneurs just as easily as you can in San Francisco. In each place, there's a need to rebuild neighborhoods with health equity in the forefront of the plans and create an inclusive strategy for both jobs and business development. So we have two distinguished individuals on this panel to take this up. Their bio sketches are included in the meeting materials. We've asked them each to speak for no more than 20 minutes, which should leave plenty of time for your questions and comments within our time period. First, we'll hear from Ann Griffith, the Senior Program Director of Hope SF at Enterprise Community Partners in San Francisco. In this role, she's helped expand Enterprise's role as a key player in public housing revitalization in the Bay Area. Enterprise has been a partner with PolicyLink on a number of projects in the Bay Area, and we've tracked Hope SF closely since its inception a number of years ago in a very ambitious local effort to transform public housing with a focus on community building and ending the isolation of low-income residents. Then we'll hear from Dan Kincaid, Director of Projects for Detroit Future City. That's the city's strategic planning framework now in its operations phase. Dan has worked with the DFC Implementation Office since its inception, where he led the initial process to build that team, secure operational funding, develop the organization's steering committee, and spearhead its first set of projects. You can tell from that language that this is not planning for the sake of finishing just an impressive document and set of maps, but boy, they have an impressive document and set of maps. I would have brought it with me to refresh my memory, but it is way too heavy to carry, but I have one back in Oakland. I first met Dan several years ago because of our own work in Detroit with the New Economy Initiative on entrepreneurship and the HUD Sustainable Communities Initiative. And Detroit Future City is everywhere and is involved in all of the different efforts in Detroit to revitalize the city. So we'll hear in that order from Ann and Dan, and then take your questions on these critical questions of community revitalization. Okay, Ann?